Hi, I'm Gretchen Ritter, and we are here today at MCITC School of the Trades, and I'm talking to Linda Orr-Brines, and she is an RN and the instructor of the CCMA class. Tell us a little bit about yourself, Linda.
Okay, I've been working here for MCITC, for the owner Carol Johnston, for a little over 7 years now. And I really like teaching. I really enjoy the camaraderie and the growth that happens with the students. And it's a nice place to work, nice place to go to school.
Now let me ask you, were you a certified medical assistant prior to being a nurse?
Prior to being a nurse, I went through a course very similar to this one, only at that particular time was just a CMA, which is a certified medical assistant. Now, however, years later, they have branched out to include separation between a CCMA, which is a certified clinical medical assistant, and then an administrative medical assistant. So you can kind of go where your strengths and weaknesses are. But I did start out in a CMA program similar to this, and I worked for once I got my certification, I worked for a variety of different physicians' offices. I worked with, let's say, a regular medical doctor. I worked for an ophthalmologist, worked for a podiatrist, cardiologist. It seemed like once I kind of learned how things went, and I was one of those people that kind of like to keep learning, so I kind of moved on to kind of keep the education going, if you will. So I did that for, it was approximately 8 years as a CMA in those different offices. And then after that time, I happened to work in one of the offices with a registered nurse. Then I went on to college, and I got my registered nurse there. And I spent approximately a little over 20 years working in long-term care, subacute rehab, assisted living, all that kind of end of things there. And then after a while, as you get a little older, nursing gets a little tough to keep up with. So I seen that the owner for here was looking for an instructor, and one of the things that I did in my job, even in a nursing care facility, was doing some education, and I really took a liking to that. So I figured, why not give this a shot? And I went and applied with Carol. We had a meeting, and roughly a little more than 7 years ago, and here I am now.
Great. Now, I know a lot of people call and ask if there is a CNA class, or are confused between a CNA or a CCMA. What are the differences?
Okay, well, there's actually a very big difference between the CNA, which is a certified nursing assistant, and the CCMA. So one of the huge differences is that with a certified nursing assistant, you primarily work under the direction of a registered nurse, typically in long-term care, subacute rehab, assisted living, all of those types of places. And as a general rule, what a CNA is responsible for is primarily having a patient or a resident caseload, where they might have anywhere between 8 and sometimes 15 people to take care of in an 8-hour shift. And their primary responsibilities are, helping the patients the residents to dress, help them to feed themselves if they cannot feed themselves, assist them with toileting needs, incontinence issues, help them with bathing, brushing their teeth, any kind of hygiene and personal care, and then also maintaining their safety. So that is kind of the direction that CNA goes, which does involve a lot of lifting, pushing, pulling, quite a bit of physical labor, physical intensive labor, in comparison to a CCMA, which is for those medical assistants. The roles in that particular area vary according to what type of physician you might work for, or if you work for an urgent care, or you possibly may work with a hospital like Inspira, for instance. But basically, to boil it down, it basically, with a CCMA, you're going to be the person that's in the back with the physician, and what you will be doing is you will be assisting the doctor with certain procedures, possibly maybe assisting with minor office surgeries. You will do documentation in the patient's medical record. You will be responsible to keep the office clean, neat, and tidy. You will make sure that all of the things that the doctor may need during the course of seeing the patients, make sure everything's stocked and ready for the doctor as he may need it. Also, let's see, another thing that you would be responsible for would be taking vital signs. If you're in a regular family practice office, for example, you're going to be dealing with different aged individuals, and you may be, taking weights on an infant, or you might be helping the elderly person onto the scale. You're just going to basically do as the doctor orders for you to do. You can even give injections and a whole wide variety of things. So you're not really doing a lot of lifting, pushing, pulling, and things that are more hard on your body. This is where you would probably, let's say, work a little bit smarter as opposed to a harder. So that
Nice.
might kind of capture the rough idea of what the responsibilities are there.
That makes a lot of sense. Now, MCITC offers the CCMA class, and that's an 8-week class.
Yes.
It meets Monday through Thursday.
Yes.
From 4:30 until 9:30.
Yes.
And at the end of that, you're able to sit for not just one, but 3 national certifications.
That is correct. You are prepared with this course to sit for the CCMA. You are also prepared to sit for the phlebotomy certification, which is a CPT. You are also able to sit for the EKG certification, which is a CET. And then the other thing is while you're here, we also do get you certified while you're here with your American Heart Association CPR course. So we get you certified through that.
Now that's a lot of information. How I want to move into kind of the structure and how you fit all that information into an 8-week class. How does that work?
Okay, so we are an accelerated class, but we are geared toward the people that are adults. Okay, this is a program that is strictly for adults. You need to be 18 years of age or older, and do have a wide range of people in that category. So basically how we squeeze that in. For example, I always start out the course with a lot of in-depth information on phlebotomy, because I like to get that book information to the people right away, so that we can get that preliminary basic structure down. And then we spend the next 7 weeks basically practicing and refining our hands-on skills with doing a venipuncture procedure, or possibly a dermal punctures, which are also included with those blood drawing procedures. So we start out there, and then the bulk of the course is primarily anatomy and physiology, and we go through each of the body systems. You have a lot of different systems in your body that work, such as a urinary system, respiratory system, musculoskeletal system, a lot of different systems in your body that work together to make you healthy and well. So in with the anatomy and physiology, also there is medical terminology that I prefer to teach with the body systems, so that, for example, when we're talking about the urinary system, I will be sharing medical terminology with you that you would hear in that doctor's office or possibly the nephrologist's office or whatever have you. Terms like dysuria, polyuria, oliguria. These things should be taught with the body system so that the students can recognize what things go together. And then after that, we have 1 week, which is kind of the hardcore week, which is our week 5, to where we just basically will address the cardiovascular system. And with that cardiovascular system, once I've acclimated you and taught you to how the heart actually works, then we can move into the EKG, where you actually place the leads. I show you how to do that. And then as we go along toward the end of that week, then I teach you the interpretation of those EKG rhythm strips, to where you will be able to look at those spikes and those bumps, and you will be able to tell what is an atrial fibrillation. You might be able to tell what is a sinus bradycardia. And this is really something good that we have here, because it's my understanding that not all of the programs will actually offer that interpretation piece. So for us, that works really well. And then toward week 7, we go over office procedures, a little bit of insurance and billing coding. We kind of touch on the basics of those things. We talk about pharmacology, because with being a CCMA, you will actually be able to give medications to the patients under the doctor's direction and order, of course. So I also teach you about that. I'm trying to think what else. Oh, and then one of the nice things is that I've been able to incorporate into this program is week 8, or your last week, will primarily be a review of everything we went over from week 1 all the way through to the end of week 7, so that on week 8 we're looking at all that stuff and you're kind of filling out some packets and you're challenging yourself to kind of remember all those things that happened so many weeks ago. And it will help bring all of that information back to the forefront of your brain, in essence. And it will give you a much better chance of passing those certifications, because I'll bring your knowledge base all current and up to date. Because when I first started here, a lot of the students were saying, man, I don't know if I can remember all this stuff. It seems like all that stuff that we did at first, I can't remember now. So we like to bring it all together, finish it up, put a nice little bow on it, and I usually feel pretty confident with when the students leave, they should be able to pass their certifications, because we don't look good unless you look good. So.
Sure. What kinds of things do you think a prospective student should know before coming in or deciding to enroll in this class?
Well, one of the great things about the course that we have here is the only thing that technically is required is that you have to be over the age of 18. You have to have your high school diploma or a GED. Pretty much that's all that is required. There is a bonus that if you are someone that has always been interested or done well in math and sciences, chances are this is going to be right up your alley, and it's going to be something that you will enjoy. It will be something that you will not struggle with. but I can usually find a way, even for someone that may not be all that great in those departments, I can usually find a way to kind of individualize things to kind of help you achieve the goal that you're looking for here. So.
Mhm. What subject matter do you find students struggle with the most during the course of your 8-week?
Okay.
Class.
The only struggling part that I've noticed is most of the time when I have classes, they are majority women. It just is what it is. In the little over 7 years that I've been here, I think I've had five males that have came. So primarily with women, the biggest challenge is most women typically have that thought in their head about, okay, I got to make sure that the kids' lunches are packed for school for the next day. I have to make sure that all the clothes are washed. I have to make sure that I prepare dinner for the family, and I have to this and I have to that and I have to. And one of the strongest things I can express is that if you want to do well in this course, you have to make what you want to do in this course just as important as everybody else that you live with, everybody else that you take, everyone else that you look after and care for, because you're just as important as everyone else. And I always tell everyone, if you don't save yourself 1 hour of time every day just for you to do some studying, you may not do very well. But if you can put aside 1 hour out of every day, lock yourself in the bathroom, lock yourself in your bedroom, put a do not disturb until whatever time on the door, so that you have that time for you. That is one of the biggest challenges. The other thing is, in all of the topics that I kind of discussed, the only one that seems to give people a little bit of an issue sometimes with being able to kind of initially grasp the concept is the EKG rhythm strips and the interpretations and the figuring out that your P wave is what your atria is doing and your QRS reflects what your ventricles and your heart are doing, and then figuring out what all the bumps and the spikes mean and all that kind of stuff.
Mm-hmm.
That's usually, if people find a little hiccup, that's usually where it's at, but
Mm-hmm.
yeah.
Yeah, I knew EKG was coming. I
Yeah.
knew EKG was coming. Let's talk a little bit about job placement.
Okay.
What is offered in terms of job placement and offering students a direction of where they might find positions after they graduate?
Okay. So with the CCMA, primarily this course is geared toward a physician's office type setting. So that doesn't mean just your family medical doctor. That also means the podiatrist, the cardiologist, the ophthalmologist, the nephrologist, the pulmonologist. You can work almost any doctor's office that I can think of. Okay, so the opportunities and wherever your interests are, and whatever the availability is open for you. Also, you can get employment with Inspira. Inspira seems to be interested in putting a lot of CCMAs in their physicians' offices, that those physicians work for them.
Now, Inspira is a local hospital.
Inspira is a local hospital, correct, sorry. And also urgent cares, complete cares, patient first. All of those kind of things, CCMA will kind of get you in that door. The other thing that is a possibility is that if you decide that you want to keep gathering sticks, by sticks I mean venipunctures. We document the venipunctures and the phlebotomy procedures that we do because per state regulations you have to have 30 live venipuncture sticks, 10 live dermal puncture sticks to sit for the phlebotomy certification. We do all that here. But some people might want to go on to possibly just do phlebotomy to where they might want to work for LabCorp, Quest, or one of those type of places. And in which case, when you get employed by that physician's office, a lot of physicians' offices will do the lab work in office. So you can continue to document your live sticks from that point on until maybe you reach about maybe 100, roughly 100 sticks. And then the LabCorps and the Quest, they will potentially look to hire you as well because you've done a lot of sticks. So that is an opportunity for employment there. With this CET, that EKG certification that you could sit for if you would like, that will open the door to places like the Heart House, or possibly even Deborah Heart and Lung. It opens the door for many other places. Potentially, maybe even you could. Sometimes hospitals hire the CETs for kind of keeping an eye on the monitors and things like that on a telemetry unit. So there's a lot of different ways that you can take these certifications that you get and find that little space that feels comfortable to you. And typically, as a general rule, we will kind of, as you would, the biggest thing out there is checking on Indeed or Monster or LinkedIn or any of those places that you would ordinarily go to look for a job. We help you to utilize those. I personally, if you haven't got a resume or you don't feel comfortable with the resume that you have, I will help you to do a resume. I don't include it as part of the course, but I do that freely. If you need help with that, I don't mind. Also, I have worked with several physicians with being a registered nurse for a lot of years. I have some physicians that I've worked with that now know what I've been doing for the last several years, and when they look for help, they call me, which is great because I can send them the students that that are bright, that really strived hard and really did a really bang up job with taking the course and grade wise, hands-on wise, and all that kind of stuff. And usually if I send them, they're hired. So there's a lot of different ways that we can kind of assist you in that job placement.
Sure. Yeah. That covers a lot. Anything else you'd like to add?
There was a couple of things I jotted down some notes. Let me take a quick peek. Basically, if students can maintain, honestly, an 85% average, pretty much throughout the course, I put a very high percentage rate of a pass on those certifications, because I kind of do my own little audit where I do checks and balances, and okay, this class I had X amount of people, and X amount of people sat for the test, and X amount of people passed. So from what I have looked at, the pass rate is very good. Generally speaking, if a person is not going to, if I don't feel that a person is going to do well, I usually know, and I usually tell them by week 3. They got to pull it together. We got to figure out how to fix what's going on in order to get you to be in that 85 percentile or better, to give you a really good chance of being able to pass, because that's very important.
Sure.
Because I only, like I said, I only look good when you look good. You know what I mean?
Mm-hmm.
The other thing is that several of the students that have come here through this class, which I still periodically keep in touch with, with a lot of them, they have taken this course, they've gone and worked in a physician's office for a little bit, and then I get a call about a year later where they say, hey, I just signed up for the nursing program, or I just signed up for the radiology program, and they got such a good feeling from here, then from working in the area, in the physician's office and such, that they said, you know what, I think I can do more. And then, it really builds a lot of confidence once you feel good, about what you're doing. and then you can go on, you can kind of move up a little bit, move up that level to maybe be a nurse, or or a radiology tech or something. And a lot of people do choose to do that. That's another thing. And then what was the other things I want to talk about? And like I said, like I was kind of going toward, if you think you want to be in a respected career like in healthcare, this is a great stepping stone. The other thing is, we typically, one thing I hear from several students kind of here and there is that they may have gone to another place to possibly take a CCMA course or something of the like, and they get pushed back and pushed back and pushed back for their start date, because a lot of these other places, they have to have 10, 12, or 15 people to run a class. We are a small place, we are a small school, and we can run with less people if we need to, because the owner is very proactive with, she really enjoys being the person that she is, and she wants to see people do well, wants to see people achieve goals, and wants to get people, in when it's good for them. And we are more able to do that, I think, than a lot of the the big commercialized schools.
Schools where you're
I'm trying to figure out a good way to word that.
You're a number, pay your check, have a seat.
Exactly. Yeah, because it's small, and it's individualized to some degree, and most of the time you're meeting with either the co-director of the school or possibly the owner of the school to do the sign up. Okay, that's how small we are, so that's another thing that might be beneficial for some folks. And then the final bonus is that every person that gets into this course, okay, on the first day, or actually even before the first day, I provide you with my personal cell phone number, so that if you have a question, a comment, a concern, or anything else at all, you can feel free to call me, and I can help you along the way, be it, Monday through Sunday. I'm available. I spent many years being on call as a nurse, so as long as it's not, 2 or 4 o'clock in the morning, I'm usually going to answer the phone or answer a text, so I am available to you. I enjoyed, offering that to the students as another little bonus, so that we can, keep close, and I can, keep you on a positive roll to meet your goals.
Great. Well, I know you have a class coming up, so I won't keep you, but I really thank you and appreciate you for talking with us today. Thank you, Linda.
And thank you for being my student. It was great. Now we get to do this too. That's a bonus too.
That's right.